How to manage constipation with diverticular disease. Managing constipation when living with diverticular disease can be a bit tricky, but there are effective strategies to help. First, let's talk about dietary changes. Increasing fiber intake is key. Fiber helps to soften stools and adds bulk, making them easier to pass. Foods rich in fiber include bran, whole grains, fruits like apples and pears, vegetables, beans, and sweet potatoes. However, it's important to introduce fiber gradually. Too much fiber, too, quickly can lead to gas and bloating, which can be uncomfortable for those with diverticular disease. Hydration is also crucial. Aim to drink at least 64 ounces, or about 2 liters, of fluids daily. Staying well hydrated helps keep stools soft and can prevent constipation. If you need to limit your fluid intake for any reason, consider fiber supplements in the form of sugar-free gummies, as they can also help. Regular physical activity is another important aspect of managing constipation. Exercise stimulates intestinal motility, which helps move stool through the colon more effectively. Incorporating regular exercise into your routine can be beneficial for overall bowel health. If constipation becomes persistent or severe, it may be necessary to use stool softeners or mild laxatives. However, these should only be used under the guidance of a healthcare professional to avoid complications or dependency. During an acute diverticulitis flare-up, managing constipation may require some dietary modifications. Initially, a clear liquid diet or low-fiber foods may be recommended to allow the bowel to rest. Once symptoms improve, you can gradually reintroduce fiber to maintain regular bowel habits and prevent future issues. It's also important to avoid straining during bowel movements. Straining can increase pressure in the colon and may worsen diverticular disease. If you notice worsening symptoms or signs of diverticulitis, such as abdominal pain, fever, or changes in bowel habits, it's essential to seek personalized medical advice. In summary, managing constipation with diverticular disease involves gradually increasing fiber intake, staying hydrated, engaging in regular exercise, and using stool softeners cautiously if needed. Always consult healthcare professionals for tailored advice to ensure safe and effective care.